If you have ever searched late at night, wondering whether premature ejaculation is normal, curable, or something you simply have to live with, you are not alone. And today, we are going to answer the most Googled questions with clarity, science, and calm authority. Many men, especially as they move into their 40s, 50s, and beyond, begin to notice changes in control, stamina, and confidence. And what often follows is frustration mixed with silence. The first truth you must understand is that premature ejaculation, often called PE, is one of the most common male sexual health concerns in the United States, affecting men of all ages, backgrounds, and fitness levels. Science defines PE not just by time, but by lack of control and distress, meaning if climax happens sooner than you or your partner desire, and it creates frustration, it deserves attention. Research shows that brain chemistry, particularly serotonin levels, plays a key role in ejaculatory control, and this is not a character flaw or weakness, but a biological process that can be influenced. Hormones, stress levels, sleep quality, relationship dynamics, and even cardiovascular health all interact in complex ways. As Dr. Mohit Khera often emphasizes in his educational discussions, sexual performance is deeply connected to overall health, especially heart health, metabolic balance, and mental well-being. That means improving control is rarely about a single pill or trick, but about strengthening the entire system that supports arousal and response. Many of the most searched questions ask whether PE can be cured permanently, and the honest answer, backed by research, is that it can be significantly improved, and in many cases effectively managed long-term through behavioral therapy, pelvic floor training, medication when appropriate, and lifestyle optimization. Studies show that pelvic floor muscle exercises, when performed consistently for at least 12 weeks, can improve ejaculatory control by enhancing muscular endurance and neural coordination. Deep breathing techniques and mindfulness training reduce sympathetic nervous system overactivation, which is often responsible for rapid climax during performance anxiety. Regular exercise increases nitric oxide production, supports healthy testosterone levels, and improves vascular function, all of which contribute to better stamina and confidence. Nutrition also plays a powerful role, as diets rich in leafy greens, lean proteins, omega-3 fatty acids, and whole grains support stable blood sugar and hormone balance. Alcohol overuse, chronic sleep deprivation, and unmanaged stress are three of the most underestimated triggers for worsening symptoms. The key message here is empowerment, because the body is adaptable, the brain is trainable, and improvement is possible at any stage of adulthood. This conversation is not about embarrassment, but about education, resilience, and taking practical steps backed by medical science. Now here is where the conversation becomes even more interesting, because one of the most searched and least understood questions is why premature ejaculation sometimes appears suddenly after years of normal performance. And the answer often surprises people. Many assume that if something changes, it must mean permanent damage or irreversible decline. But the human body does not operate that way. Sudden changes frequently signal stress overload, hormonal fluctuation, relationship tension, or cardiovascular shifts that have quietly developed over time. The nervous system is incredibly sensitive, and when chronic stress elevates cortisol for months or years, it can alter serotonin balance and heighten the body's fight or flight response, making climax occur more quickly. Poor sleep compounds this issue because inadequate deep sleep reduces testosterone production and increases anxiety sensitivity, both of which affect sexual control. Another highly searched question asks whether age automatically causes PE, and the scientific answer is no. Age alone is not the cause, but aging can expose underlying weaknesses in circulation, metabolic health, or pelvic muscle endurance. Blood vessel elasticity decreases when lifestyle habits are poor, and reduced vascular efficiency affects arousal patterns and sensation control. What makes this especially important is that premature ejaculation can sometimes be an early signal of broader health concerns, including metabolic syndrome or early cardiovascular strain. This is why experts like Dr. Mohit Khera consistently emphasize that sexual symptoms should never be ignored, because they often provide valuable insight into overall male health. At this point, you may be wondering whether medication is the only reliable solution, And this is where suspense enters the conversation, because the answer is both yes and no. Certain medications, including selective serotonin reuptake inhibitors prescribed at specific doses, have strong clinical evidence supporting their ability to delay ejaculation, and topical anesthetic agents can reduce penile sensitivity temporarily. However, medication without lifestyle correction often produces incomplete or temporary improvement. The real transformation occurs when behavioral training, pelvic floor strengthening, cardiovascular conditioning, stress reduction, and medical guidance are combined strategically. Studies show that men who pair medication with structured therapy programs achieve longer-lasting results than those who rely solely on prescriptions. Another common question involves masturbation habits and whether frequency affects control, and research suggests that rushed or anxiety-driven habits can condition the brain toward rapid climax patterns, while mindful pacing exercises can retrain neural pathways toward delayed response. This concept of retraining the brain highlights a powerful truth. The body follows repetition. When breathing slows, muscles strengthen, and confidence grows through practice, the ejaculatory reflex becomes more manageable. The nervous system adapts when given consistent signals of safety and control. This is not a quick-fix story, but it is a hopeful one, because science confirms that change is possible when knowledge is paired with disciplined action and patience. The final and perhaps most empowering question people ask is whether they can truly regain confidence and feel in control again. And the answer is grounded in both science and human resilience, because improvement is not only possible, it is realistic when approached with commitment and patience. Confidence does not return overnight, and it does not come from a single strategy, but from stacking small, consistent wins that rebuild trust between the mind and body. When you strengthen your pelvic floor muscles 3 to 4 times per week, you are not just training tissue, you are reinforcing neurological pathways that improve timing and endurance. When you prioritize 7 to 8 hours of restorative sleep, you stabilize testosterone production, lower stress hormones, and enhance emotional regulation. When you choose regular cardiovascular exercise, such as brisk walking, cycling, or swimming, at least 4 times per week, you improve endothelial function, circulation, and nitric oxide availability, all of which contribute to stronger and more sustainable performance. When you reduce processed sugars and emphasize whole foods rich in magnesium, zinc, and omega-3 fatty acids, you support nerve transmission and hormone balance in measurable ways. These are not abstract ideas, but physiologically proven mechanisms that accumulate over time. Many men overlook the psychological component, yet cognitive behavioral strategies can significantly improve ejaculatory control by reframing catastrophic thinking and performance anxiety. Visualization techniques, slow controlled breathing during arousal, and progressive muscle relaxation reduce sympathetic nervous system dominance and allow the parasympathetic system to guide a calmer response. This is where philosophy meets physiology, because discipline in daily habits creates freedom in intimate moments. Dr. Mohit Khera often speaks about treating sexual health as an extension of total wellness rather than an isolated problem. And this mindset shifts the narrative from fear to opportunity. Instead of asking what is wrong with me, the better question becomes, what can I strengthen today? Suspense fades when knowledge replaces uncertainty, and empowerment grows when action replaces avoidance. Another important reminder is that communication with a partner reduces pressure dramatically, because shared understanding lowers anxiety and increases emotional safety, which directly influences performance. Submitting questions, seeking professional evaluation when needed, and staying curious about your own health demonstrates maturity, not weakness. Your body is responsive to consistency. Your brain is adaptable through repetition, and your confidence can be rebuilt through measurable progress. There is no expiration date on improvement, and there is no shame in pursuing better health at any age. The path forward is practical, structured, and supported by science, but it requires engagement from you. If you are benefiting from our topics, please subscribe, like, and turn on the bell notification so you can see our new videos early.